Advanced care planning, it was initially used for the process of making plans that would be invoked when somebody lost capacity or the ability to communicate. But actually now it's used more generally for any plans that record someone's preferences about choices for their future care. And it's anything, any planning with a patient about their future care can be called advanced care planning. There is evidence for advanced care planning. I think the most pertinent evidence at the moment is coming out from the electronic palliative care coordination systems. In our area we've got CMC, or Coordinate My Care. It hasn't actually been taken up very widely in Barnet, but throughout London it has been used, and the evidence is coming back from them that of the patients who are included on a CMC record, only 17% of those patients die in a hospital, which compares to 54% nationally. So in other words, 79% of patients who have a CMC record are dying in their preferred place of care. So I think that's pretty strong evidence that having an advanced care plan actually makes a difference. Obviously with the CMC record, we are talking about a selected group of people who have either elected themselves or through their proactive healthcare advisor to take on this extra burden of having an electronic copy of their advanced care plan. With regard to advanced care planning and symptoms, there have been a few smaller studies, one of which I like to use, which is a statistically significant study. It was carried out by a hospice, looking at the last week of a patient's life. And in those patients that had made an advanced care plan, they required significantly less both analgesia and anxiolytics compared to those patients who hadn't made an advanced care plan. As I say, it was quite a small study. There were 60 patients in each arm, I believe, but it was deemed to be statistically significant. So it makes a difference both for the patient and for the carers and relatives and for the doctors.